Okay, it's Dr. Mobley here showing you how to take care of a facelift dressing. It's been 2 days. Just going to use a large bandage scissor. You may have something at home that's not quite as fancy, but it'll work. And if you just cut through this gauze, it will begin to kind of release. Just need to snip a lot of spots and the elastic just kind of gives. There's a lot of gauze after a facelift, so just notice several layers. First you want to get that kind of elastic layer off. You're going to look terrible. It's the nature of facelift surgery. You look worse before you look better.
Yeah, I kind of figured.
So you always expect to look a little worse before you look better.
I'm
and
prepared.
As doctors and nurses and surgical people, the old dry blood doesn't bother us, but as a layperson you might think that's a lot of blood. It's really not. It's pretty normal. Try not to snip the hair, of course. No need to.
I've been wanting to itch.
Yeah, itchy, right? So wrapped up and tight.
Yeah.
More gauze. That's the drain there. So you can see the drain if you get really tight. There's a little, let me get something to point with. A little black stitch there. You can kind of see it there. And the stitch wraps around the drain that holds the drain in. But if you really follow that black stitch to the skin, that's where you need to snip so it can come out. So you can kind of snip right there where the stitch is at the skin level. Now for this, we have medical scissors, but maybe at home, sometimes I tell patients that like a fine bathroom kind of manicure scissor works pretty well. They're pretty fine. You get them from the drugstore.
Okay.
So you snip that little stitch there. Now it's free. Now it's hard to tell in a video how hard to pull, but it's not that hard. You just kind of give a gentle, firm tug, and out it comes. And that's the drain. Okay, we'll keep snipping here. Watching the hair. Again, that might seem like a lot of blood if you're doing this not for a living, but that's just very normal. Remember, blood is a very powerful pigment, so even small amounts of blood can really stain gauze. So it always looks like more than it is in terms of volume. That powerful red pigment. Now you may see a really messy, bloody, kind of compressed face, but as a surgeon I see a great new neckline, a visible chin, nice flat skin here, so all this to me looks great. Can totally appreciate as a layperson that may not seem like it looks great, but that is very, very normal for a facelift a few days after. Now I'm going to use, this is just a little canister of some hydrogen peroxide. We've soaked a whole bunch of Q-tips, and there's probably 12 or 14 Q-tips in there. You'll go through a lot. Better to go through a lot than not have enough on hand, so just get your Q-tips ready. They're kind of almost dripping wet with hydrogen peroxide. And anywhere you see any dry blood, just begin to rub on it. You know, not too firmly, but just kind of rub on a little bit. Yeah.
It tickles.
Yeah, there you go. That's good. And the thing I like about hydrogen peroxide is how when it makes contact with human dried blood, it kind of turns that almost that little brown, bubbly kind of paste. And that's good. It kind of softens the dry blood. It removes it off of your skin. And so you just want to get to that little brown kind of slurry. I'm not sure the best noun to use, but you just get that little brown liquid. And then you can just, sorry, sweetie, just kind of wipe it off the skin like that. Now remember, back here behind the ear, we do shave as little as we can, but we had to take away about a ½ inch of hair. Now when the hair is more shampooed, everything's going to fall over that incision. But for now, again, just clean along these stitches. The key to this incision is that the hair in a few weeks will start to regrow, and it actually grows right along where the incision is hidden. And so in about a month or two, you should be able to wear your hair back carefully and not have anyone see anything. So again, I'm just going over those stitches with Q-tips that are soaking wet with hydrogen peroxide. It's the hydrogen peroxide kind of automatically sort of detects the dried blood. It bubbles into that brown liquid, and then with a gauze, just becomes real easy to clean off. And so now we've got the last little one there is the one kind of in the temple hair area, also hidden in the hair. Just kind of go across it gently with the hydrogen peroxide. Notice how it kind of seeks out the blood and kind of turns it to that little brown liquid. Now it's also okay after a facelift. You can take a short shower and rinse your hair, and I encourage it. Don't take a long, hot, steamy shower, because when you're in the shower, that heat dilates your blood vessels and it can actually make you bleed after surgery. So you want to kind of get in, do a quick bathing, and get out. Kind of lukewarm, doesn't need to be uncomfortably cool, but don't turn on your fancy home steamer shower and spend 20 minutes in there. It's not good for you. Just get in, get clean. You can shampoo around these incisions. When your fingers are all sudsy with the shampoo, you can kind of go through your hair, and that'll just make you feel, you know, a lot better. So think of it as the first step was the dressing removal. Second step was the hydrogen peroxide clean. Now third step is going to be to apply some ointment. Ointment usually feels pretty soothing to a patient. So we just take our antibiotic ointment. We typically recommend you buy the over-the-counter bacitracin. And anywhere a stitch is placed, you just put a nice kind of soothing smear of ointment around the earlobe, up in the hair. You know, if it's your own human body and you're not the doctor taking care of a patient, you can just take a little bit of this on your finger and just smear it behind the ear. I use Q-tips, it seems a little more professional, but when you're doing this to yourself, you can just put a little bit on the tip of your finger and wipe it back behind your ear, because you know there's some stitches kind of hidden back here. So anywhere there's a stitch, you just kind of give it a nice little coat of ointment, and that's what you do.
Oh.
Now we're at the chin. Chin up a little bit, sweetie. And there's an incision under here. Now, if you look at these skin edges, they're kind of puckered out. That's a common expression. In plastic surgery, the technical term is we did skin edge eversion. Layperson might say the skin edges are puckered. Now, that's often alarming to a patient. They look at it and think, oh my goodness, would they do something's wrong? Believe it or not, in plastic surgery, it takes a special little stitching technique to get the skin to kind of evert in that way. But what we know from years of plastic surgery experience is that if the skin edges are everted today, for the rest of your life, 6 weeks from now, they'll flatten, and that way you won't have a little depressed scar. You'll have a very flat scar. So when you see those puckered skin edges, if you're doing this at home, don't panic. It's all purposeful. We actually takes extra surgical time to get it to pucker, and it's going to look great long term. So still doing that hydrogen peroxide. So a little stubborn scab there. If you see something really sensitive like that, just don't pick at it too much.
Okay.
You can make it worse. Just get it as clean as you can on sort of the first round. And what you'll find is if you just coat it with some ointment, it'll soften, and maybe the next day or so, you know, you'll get it perfectly off of there. But don't, if a scab looks a little stubborn, if you pick at it too much, you'll just cause more of an irritation. So just goop it up with the greasy ointment, and you'll see how it just will begin to heal without needing to be too aggressive on it. So the stuff that bubbles away easily, let it bubble away. But if there's a little stubborn scabby spot, just kind of leave it alone.